When you think about head and neck cancer, you think about cutting out the cancer. But the head and the neck is an area with what I call a lot of high-end real estate, and you have to be able to function when you're done, and not everything can just be closed up after we make a hole. And so sometimes we have to move tissue around to rebuild the structure that had to be removed with the tumor. So it could be the tongue, it could be the jaw, it could be an area of bone around the orbit. It just depends on where the cancer took hold. Talking with them, saying this is, we're not going to rebuild things necessarily the way they were before the cancer ever took hold. Things may never completely be the same. I think to give that patient that information as far enough in advance as you possibly can helps them mentally process that. And I think that in many ways our patients struggle post-operatively with the difference not only in how things are functioning, even if they are functioning, but it's in how they look. When you're the person who's living with that change or looking in the mirror or refusing to look in the mirror, it's a very different situation. And I think as the surgeon, you have to be the one who can talk with them every single day that they need to be talked about and reassure them and be there for them. Somebody having a tracheostomy is very different than somebody breathing out of their mouth or their nose. And I think you have to talk to them about it, and I think if you have educational information to kind of give them a visual idea of what it is that they may be living with, at least temporarily, if not permanently, I think that helps them kind of wrap their minds around things. That said, that never truly, I think, prepares them for what they're about to experience. And I think you have to most importantly be realistic with them and not just say something to give them false hope, because when it doesn't turn out that way, they're even more disappointed. Whereas if you set them up that, this could be how it is, but then it's only half as bad as they thought it was going to be, they're in a much better place emotionally and psychologically. And I think that that's a huge component that helps them in their journey of recovery.